Hi everyone, welcome to this week's APRU Global Health webinar. Thank you so much for joining. My name is Melissa Withers and I'm going to introduce this evening's webinar. So first, this is webinar number 4 of our series of 8, which is very exciting. And I am not going to be the moderator for this evening, which is also very exciting. But first, I'd like to tell you a little bit about the APRU network. So APRU is a nonprofit network of more than 50 universities in the Asia Pacific region. And it's been around for more than 20 years, and the secretariat is based in Hong Kong. And I am the director of the APRU Global Health Program, which is housed at USC and has been around for more than 10 years. So we are interested in, well, we'll talk more about our working groups in a minute, but we're really doing these webinars in order to, number one, showcase the vast expertise within our network and to talk about these really important issues from multiple perspectives and from international setting as well. So we'll post the websites there if you're interested in looking more about all the activities that we have going on. So we have a working group on migration, and you'll hear more about that in a minute. But I have a couple of other announcements that I would like to make before we get started. So the first one is that starting in July for our next 4 webinars, we will be able to offer certificates of participation for those who need them. Of course, we have very limited human resources, because that would be me, but if you do need one for your employer to get, continuing education credit or whatever, then we will be able to provide those. The next thing I wanted to mention is that on the theme of migration, we are doing a special special issue of the International Journal of Environmental Research and Public Health. And the special issue is called Patterns, Determinants, and Community-Based Interventions of Migrant and Refugee Health. And we have, in addition to myself as editor, we have Dr. Hall, Dr. Loganathan, and Dr. Chang, who are all helping us with the editors. So the deadline for that is submission, if you're interested in submitting, is November 30th. But the articles are being accepted and published on a rolling basis. So it's an online journal, pretty good impact factor, 2.47. So I would encourage you to apply. We also have, even though there is a publication fee, we do have waivers for some select papers coming from low and middle income countries. So please take a look. We'll post the link there in the chat as well. Okay, so next I would like to introduce you to tonight's moderator. So I am very pleased to tell you that Dr. Brian Hall will be moderating. He is an associate professor and director of Global and Community Mental Health Research Group at the University of Macau. And he is also associate professor within the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. He has done a postdoc from the National Institute of Mental Health in psychiatric epidemiology. He also did a Fogarty Global Health Fellowship in China, looking at social networks, HIV, and mental health among migrant communities. He has already a very illustrious career in doing work on migrant health, mental health, sexual health. He serves or has served as a consultant for a range of organizations, WHO, UNICEF, UNAIDS, And you can take a look at his CV there, which is on the APRU Plus website. He's also the founding co-chair of the Migrant Health Working Group of APRU Global Health Program. And so I am very happy to welcome Dr. Hall as our moderator for today. Thanks for joining us.
Thanks, Dr. Withers, for that great introduction. And I'm just absolutely thrilled to be here today to moderate the session on a very important topic related to COVID-19 and Filipino overseas Filipino workers. So this is the fourth, as you mentioned, the fourth webinar in the series. The topic is Filipino modern-day heroes and COVID-19, and that talk will be given by Dr. Jean Encinas Franco from University of Philippines, Diliman. And we are co-hosting this with the Migration and Health Working Group, as you mentioned, and it's very exciting to have migration be a theme in a part of this ongoing webinar series. I think migration is an incredibly important topic. There are over 250 million migrants in the world, and I think that more work needs to be done to address their health and well-being. And this webinar is also an open invitation to people who are interested in topics related to migration and health to reach out and be in touch with our working group. There'll be contact information, I'm sure, in the chat. So this talk will be 30 minutes, and we will have a 20-minute question and answer period to follow. And I just wanted to invite all of our participants to use the question and answer function, which you can see down below. I'm sure you guys are all familiar with that. We've been doing Zooms now for a while. Use the question and answer function during the talk. Provide your name, your institution or organization that you're a part of and where you're based, and please ask questions of our speaker. I think the 20-minute question and answer period can only be rich if you contribute your questions. So please do so. I look forward to that. So welcome everybody to the webinar. I now have the absolute pleasure of introducing our speaker today, Dr. Jean Encinas Franco. Jean Encinas Franco is currently an associate professor in the Department of Political Science at the University of Philippines, Diliman. She has published on issues linking gender, human rights, and the politics about migration. She has also written reports for international organizations such as International Labor Organization and UN Women. Currently, she's a deputy director for research of the Philippine Migration Research Network. And before her work in the academy, she's worked for many years in the Senate of the Philippines. So she's an expert on the topic about migration from the Philippines and the representation of overseas Filipino workers as modern day heroes. We are very fortunate that she agreed to give a talk today for us. And so please, let's all warmly welcome her.
Oh, you're muted, Jean.
Thank you, Brian, for that wonderful introduction. I'm delighted to be speaking before you today from Manila, and I would like to thank APRU, Melissa, and Tina for this wonderful opportunity. Let me give you a run-through of my talk today. I will first talk about the origins of international migration from the Philippines. Then I will present to you COVID situation on the Philippines, as well as of our migrant workers all over the world. I will also talk about the situation of health workers, particularly Filipino nurses in other parts of the world. Then I will discuss a little bit of my thoughts on government response, and then the conclusion. International migration from the Philippines is actually part of our colonial history. Scholars usually trace this with the forced labor of Filipinos aboard shipping vessels plying the Manila-Acapulco galleon trade. But contemporary migration trends is traced back to the 1974 Labor Code, which was then instituted by the dictator Ferdinand Marcos. The idea was to send workers to the Middle East to mitigate the impact of the then oil price crisis in the 1970s. However, succeeding presidents have actually seen the potential of remittances to prop up the economy such that an entire bureaucracy has been built catering to the different phases of immigration, from pre-employment to repatriation and reintegration. Currently, the protection of Filipino migrant workers all over the world is one of the three pillars of our national security. Such is the case that the Philippines is regarded as a quote-unquote model among migrant sending countries. It was, however, then President Corazon Aquino, who succeeded Marcos, which started to call migrant Filipinos as modern-day heroes, or bagong bayani in Filipino, in our local parlance. This label has discursive origins in Catholic notions of suffering and sacrifice. So it is something very powerful for most Filipinos. Banks, remittance centers, movies, television shows, shopping malls use this or appropriate this label towards migrant Filipinos. I argue, however, that it is a legitimating tool to normalize suffering and sacrifice in working abroad and justifies the state's role as a protector, quote unquote, and not a
Sorry
label.
to interrupt, Jean.
Important.
Could you put your slides on presenter so that they're bigger for everyone?
Sorry.
Down at the,
Yeah.
thanks.
Is that okay?
Yes, thank you.
Okay. These heroes are actually more than 12 million, as estimates would have it, and they are located in more than 200 countries and territories around the world in different job categories. Last year alone, they sent a total of $30 billion in remittances, thereby providing welfare support to their families back home here in the Philippines and contributing to about 8 to 10% of our gross domestic product. But labor export is highly political. The government has to balance competing state interests in maximizing remittances and being perceived as a quote-unquote protector. Thus, it is a political issue that the government has to contend and manage almost on a daily basis. This is particularly the case because overseas employment is also crisis prone, and that it usually involves life and death situation of Filipinos abroad and other emergencies such as conflicts, wars, and diseases and disasters. For this reason, ideally, the Philippine government has vast experience in helping Filipinos get repatriated when crisis occurs. Having said that, COVID-19 is actually a case in point. Currently, more than 30,000 Filipinos have COVID, with nearly 2,000 Filipinos dead. However, the other health crisis is the rising number of COVID cases among Filipinos abroad. As of June 19, 2020, there are more than 6,000 COVID cases among Filipinos abroad in 53 areas and around the world, with 483 deaths. Middle East has the most number of cases at more than 200. With this overall picture of migration and COVID situation, allow me to focus on the migration of Filipino nurses. The Philippines is actually the world's top exporter of nurses, but the migration of nurses is also a product of our US colonial experience. The US designed the initial curriculum of nursing profession in the country. In the 1950s and 60s, the country became a primary source of nurses to respond to nursing shortages, primarily in the US, but also in Europe. Nonetheless, it is often said that nurses became subject to the requisites of the market, the so-called quote unquote bamboo ceiling. Thus, most nurses do not necessarily make it abroad because when the economy is down or not doing well in migrant receiving countries, there is decreased demand. Dominant accounts indicate that the primary reason why Filipino nurses migrate is due to salary differentials. As you can see in the slide, the wage differential is actually huge. By the way, 183,273 pesos is nearly 4,000 US dollars. But that's a year's salary for nurses in the Philippines compared to annual salary of nurses in other parts of the world, as you can see. As you can see from the slide, from 2010 to 2015, that's the available data that we have from the Philippine Overseas Employment Agency. That's the annual outflow of Filipino nurses. And if you try to look at it and compute the average, it's about 17,000 plus Filipino nurses going abroad from 2010 to 2015 on an annual basis. But this is just the data for nurses who have actually gone out to work abroad as nurses, because the Philippine Overseas Employment Agency accounts for the contracts or job orders. It doesn't account for Filipino nurses, registered nurses, who work abroad as caregivers and domestic workers. Migrant nurses, like all migrants, are not necessarily the poorest of the poor. Nursing education is actually beyond the reach of ordinary poor Filipinos or low-income Filipinos. Some are second-generation migrants, while others live in multi-generational households of nurses or medical professions in the US, UK, and Canada. Needless to say, females predominate the nursing profession, as it is in many countries around the world. With the onset of COVID, nurses from the Philippines, especially those in the US, Europe, and the United Kingdom, have actually acquired visibility. They have become topics of human interest stories with regard to COVID. Reports would be about the fact that they are heroes and frontliners that suffer from insufficient PPEs, poor working conditions, and discrimination in their communities. There are also reports that valorize the Filipino trait of caring and willingness to work knowing the risks, that they hardly complain, as they say, of Filipino nurses. But to my mind, discussions like this actually depoliticize their plight. It veers from the structural conditions of race and ethnicity, gender, and policies of both migrant receiving and migrant sending states, which make migrant nurses vulnerable. In fact, before COVID, Filipino nurses, both here and abroad, are actually invisible due to de-skilling. Some are nurses but resorted to being caregivers due to non-recognition of skills in host countries. For instance, at the height of COVID in Spain, media reports show that because the Spanish government was very fearful of the collapse in their health system, they have actually allowed Filipino nurses in Spain who came as caregivers to actually practice in the Spanish health system. The, the skilling of nurses is actually due to government promotion of nurses on the Philippine side. For instance, currently, local nurses who are not abroad are actually not in hospitals, most of them, but in business process, outsourcing industries, and expensive spas. In the United Kingdom, the death of Black, Asian, and minority ethnic communities, for instance, are now being investigated, with analysis focusing on their physiological attributes such as hypertension, diabetes, etc. But the reason for their deaths is also due to their position in the labor market. Their visas and jobs are at the mercy of their employers. This is true for nurses in the United Kingdom. What I'm trying to say here is that both local and migrant Filipino nurses have long been the frontliners in the health systems of the Philippines and the rest of the world. They are not just frontliners currently due to the COVID-19 pandemic. Their plights are actually interlinked, meaning the plights of Filipino local nurses and Filipino migrant nurses abroad. Their plights are interlinked in the global political economy of health governance that usually does not result in a quote-unquote win-win situation, even if they are packaged and promoted as such by migration management and the so-called, for instance, ethical recruitment processes that have been promoted. On the part of the Duterte government, which actually also feared the collapse of the Philippine health system, it immediately banned the deployment of nurses abroad. Last March or April, at the height of the rise of COVID cases in the Philippines, but it backtracked due to pressure from the public. Only those with contracts were allowed to leave. It also provided $200 to migrant workers who are affected by COVID. For those local health workers who die of COVID, a $20,000 assistance is actually provided by the government. Unsurprisingly, the heroic discourse has been promoted currently pertaining to local nurses for the first time. Prior to this, public discourse on heroism only pertained to migrant Filipinos in general, and of course, by extension, also to migrant Filipino nurses. Currently, there's also a massive recruitment of local nurses, but the salary is only $500. It remains to be seen whether local nurses who have remained in the Philippines would actually take this on instead of working in other industries. This is actually due to demand from government hospitals needing more health personnel due to COVID-19 cases. But there's actually also good news. Despite this situation, the COVID-19 pandemic has also allowed nurses to find their voice, both local nurses and those abroad. For instance, the Philippine Nurses Association asked the United Kingdom to help Filipino nurses complaining of lack of PPEs. Unions in the United Kingdom and the United States have actually also been actively helping express the sentiments of nurses who fear that they might lose their jobs if they themselves complain about what's happening in their hospitals or clinics. In the United Kingdom, a the Balik Bayani, or some sort of a program has been launched by Filipino nurses to help health workers and their families in need due to the impact of COVID-19. By the way, in the United Kingdom, there are about 50 Filipino nurses and health workers who have perished due to COVID-19 as of a week ago. What I'm trying to say here is that overall, COVID-19 has actually brought the transnational organization of care that scholars have pointed out into stark focus. In other words, the plight of Filipino nurses who remain in the Philippines and those abroad are linked due to state policies and transnational practices of sending and receiving states that impinge on race, ethnicity, gender, and colonial history in the case of the United States. And that while they are heroes and frontliners, they've long been heroes and frontliners actually, even before COVID. And the fact that the discourse of heroism is being waged repeatedly due to COVID, whether on the part of local nurses or Filipino migrant nurses, it's not something that should be, what do you call this, promoted. I mean, yes, they are heroes, but to the extent that this has consequences on how their work is going to be perceived is something problematic. I hope that the discourse on heroism and them being frontliners should not be um, seen as a way to downplay their working conditions, working conditions that have to be reformed, that have to be improved, whether there's COVID or other diseases in the future. Post-COVID, my sense is that a long-term response would be along the lines of observing intersectionality, because this have been missed by most countries, even by the Philippines, for instance, in looking at policy or program responses in relation to COVID-19, thinking about age, sex, um, class in terms of policy responses, such that a long-term response to improving the health conditions of nurses and migrant workers should be about inclusiveness, and that valuing care work should be an important part of the global political economy in terms of responding to health crisis. That's it. Thank you very much. I'll be welcoming your comments and questions. Thank you.
Dr. Encinos Franco, thank you so much for that wonderful presentation. And I think it's really useful for us to be thinking about contextualizing the factors that affect OFWs, but then also nurses generally during COVID-19, as they are frontline health workers and exposed to a lot of stress, and also the potential harms of direct contamination with COVID-19. I think it's really useful to have a broader context, and you've really done a wonderful job of helping us to think through some of those intersectional pieces as well, gender as being one, and also linking it back to a colonial history of why some of these factors are even occurring. There were many questions that came up, which is wonderful, and we still have the opportunity for people to continue to pose questions. I've selected a few that maybe we could begin with. So the first question we have here is from Maria Andespi, who is from USC, and she asked, do the Filipino nurses in reference include those who permanently live in the US or who become US citizens, or do they have dual citizenship? So I think this question is interesting because it really touches on identity and citizenship and belonging, and how migrants can integrate into a receiving country or not, and how that actually might increase precarity or other concerns as well. So maybe you could speak to some of those issues.
Yeah. Filipino nurses in the US do not, I mean, even if they have permanent residency in the US, for instance, even if they are already US citizens, do not stop being Filipinos in terms of their identities, and they're part of those who are called modern day heroes by public discourse here in the Philippines and by our government, because they continue to send remittances. They continue to take care of their families here in the Philippines.
So their identity remains Filipino.
Yeah,
and
exactly.
Sure. Okay. But what about citizenship? Is there a pathway to citizenship for those health workers in the U.S. or because I think it's interesting too when we think about outmigration or OFWs, we could count that group differently depending on what we consider their citizenship, and that number can be actually quite large. There are millions of Filipinos in the world, but I think the official number is something like 11.5 million.
Yeah. There are in the US, that's why it's a popular destination, because there's a pathway to citizenship actually in the US. That's why it's a popular destination, but it's also very difficult and quite expensive for Filipino nurses to get to the United States. The requirements are quite different compared to, for instance, Saudi Arabia. The training and experience requirements are different.
So we have another question from Cora Anunuevo from the Philippines. She's a nurse there, and she said that the term modern day heroes, unsung heroes, is rhetoric, legitimizing only suffering and sacrifices of OFWs. Should we stop using this popular term if it's just legitimizing suffering?
My sense is that it should be stopped, because it sort of also normalizes the role of the Philippine government as a quote unquote protector, other than the fact that it really encourages Filipinos to work abroad. When we say that migrant Filipinos are heroes, we're not discounting the fact that they get abused, they get exploited, or some of them have poor working conditions abroad, but we're just trying to sort of look at it from a critical perspective, so that we can critically assess the massive role of the state in overseas employment, which is not the case in other parts of the world, which is not the case in other migrant sending countries.
Even more critical point that Erlinda Palangas brought up here is that frontliners are considered modern day heroes, but in one way of thinking about it, they could also be seen as modern day slaves. And I think, the modern day slavery narrative is also one that has emerged and one that people are really thinking a lot about, and especially when we think about migrant domestic workers as another group.
Yeah, yeah, yeah. That's a good question. But the power of the heroic discourse is such that even migrants themselves use this, but especially those who believe that they're heroes for their families, but then the state will never use the modern slave discourse. So what I'm trying to say is that the modern day hero discourse serves the end of the state and the elite, who benefit a lot in terms of remittances, in terms of not rocking the boat of inequality that's persistent here in the Philippines.
Erlinda also was saying that the discourse here, some of the reasons that the salaries are so different, as you pointed out, which there's a shocking disparity in terms of the amount of pay that nurses are getting in the Philippines versus in other countries, and that actually is one of the the major reasons, as you pointed out, that people are out migrating. What kind of policies might need to change, or what kind of differences would have to be brought about in order to address that key issue in terms of out migration?
Well, the government has time and again tried to do something about it, but the salary differential is just too uh, big, But and the main reason also for the depressed wages is the state promotion of outmigration of nurses. That's why there are so many nurses here in the Philippines. And if you have a huge supply, I mean, economists would tell us that the wages will be depressed.
So it's really also a factor of oversupply.
Yes, exactly.
Many nurses in the Philippines, and that stimulates migration. I think another aspect of this topic that's really important is also the health and well-being of the migrant workers. You touched upon this a bit, and some of the questions that also were raised really were about the psychological aspects of being a migrant worker, but then also experiencing some of the stresses of work and being away. Can you speak a little bit about maybe some of the psychological consequences of migration and how they potentially might be addressed?
Yeah. That Thanks for asking that question. No, but yeah, and that's very true because while the Philippine government has been touted as a quote unquote model in migration management, I think mental health is still very much a work in progress. And I mean, prior to COVID-19, there are a number of migrant workers who have been reported to have had mental health issues. But since March, when COVID-19 has had extensive coverage here in the Philippines, particularly in relation to migrant workers, there have been reports of suicides, for instance, among seafarers who have been quarantined for too long and who have lost their jobs and who are worried about their families. So these are things that should be taken into account in the future in terms of the government assessing their assistance to migrant workers.
Is there a broad recognition of the mental health and well-being and psychosocial support needs of Filipino OFWs?
Um, there are provisions, there are policy pronouncements in programs, but I guess it's something that has not been recognized extensively in the Philippines. In fact, the mental health law has just been passed about a year or 2 years ago. So publicly, on a societal basis, it's still a work in progress. But it's I would say that it's better compared to 5 years ago, for instance, when mental health is still very much stigmatized.
Mhm. But I mean, I think, you know, your response also reveals another challenge, and that is that, you know, in order to address migration mental health or migrant mental health, there also has to be a recognition of mental health domestically as an important
Yes.
concern
Yes.
and to be addressed. And the mental health law was something that, you know, a couple of years ago was something that started really promoting the dialogue and pushing that forward.
Mhm.
I believe that OFWs were included in that.
Mhm.
Then they have another issue about seeking and receiving mental health in the countries in which they are
Yeah.
working.
Yeah.
Um, barriers on multiple sides that come up. Uh,
Indeed.
okay, we have another question from Professor Natina Panaligan from Philippines. She says, you know, the term modern day heroes shared in your lecture today, is it recognized by the government of the Philippines? And how can we say so? How do you equate the recognition efforts compared to other nations around the world in terms of, I believe in terms of sacrifice or in terms of that heroic narrative? Is that a uniquely Filipino
Yeah, it is uniquely Filipino, but because for instance, I've read a paper in Mexico, there is also a heroic discourse, but it's, I mean, particularly to Mexicans crossing the border to the United States. But the discourse has a different meaning because it's like taking the land that's theirs in the first place. La patria, for instance, instead of suffering and sacrifice, that has profound meanings in terms of, I mean, uh, Philippine history.
hmm. What are some of the historical features you say Filipino history? And I think maybe that's something useful that we don't
Yeah,
really.
yeah. I think it's also historians would look at heroism in as a form of sacrifice by way of tracing the influence of Spanish Catholicism, because historians would say that the bayani, or the hero, the origins of heroism pre-colonial days would be very much different. Not really a form of sacrifice. It tells you about somebody who's strong, no? But then after the Spanish colonization and the death of our national hero, Jose Rizal, in the hands of the Spanish colonizers, it took on a different meaning, to mean suffering and sacrifice, the passion of Jesus Christ for the sake of the many.
That's really interesting. I mean, it's interesting from a perspective of also, I mean, thinking about colonial aspects, but then
Yeah.
also religious aspects and how those things converge to create a narrative. And I think often, you know, at least in global health and in public health, sometimes we forget to think about the historical origins of how populations have developed over time in different contexts. We have another question from Jennifer Fabros from the Philippines. She's a part of PS Link, so the Consolidated Council of Health and Allied Professions. And she says, and I think this, I'm going to read this. I think it's important because it really talks about some of the issues, the underlying issues and exposures that will reduce health in populations. So many Filipinos, especially nurses, are migrating abroad due to precarious work, so substandard employment, lack of security or tenure, low salaries, poor working conditions. How do you think we should address it? So again, it's like getting back to kind of this question of addressing these issues. These are the bigger questions, right? So because we have good laws and policies, but they're not being implemented, like Republic Act 7305, Magna Carta of Public Health Workers, and Republic Act 9173, Philippine Nursing Act of 2002.
Yeah. The plight of local nurses is actually also um, borne by the fact that the Philippine government expenditure for health has been quite low and below international standards set by the World Health Organization. We have not spent for health beyond the 5% standard set by the World Health Organization. That's one. And the with regard to migrant nurses, I guess the perfect uh, way to protect them is for them not to leave abroad, because the jurisdiction of the state, no matter how many or how strong the bilateral agreement is, if there's one, ceases to transcend beyond its borders. So yeah, so creating the government should help create conditions for decent work to thrive and to grow in the Philippines. That's the perfect way to prevent them from leaving abroad for work.
Yeah, and it seems like that's a real challenge. I mean,
Yeah.
in terms of policy and change is to upgrade conditions and, like you said, decent work, promote decent work at home, because in many cases, I believe that when Filipinos go abroad, the living and working conditions aren't necessarily improved. The financial situation might potentially be improved, but the living and working conditions, and precarity, discrimination, and other factors also reduce their well-being abroad. What is there anything you can offer in terms of a solution and how to better engage with other countries, or the receiving countries, to improve the welfare and well-being of migrant workers when they go abroad?
I 5 years ago, the International Labor Organization came up with a report that says that most of the bilateral agreements that the Philippines have in terms of, you know, migrant nurses, relating to migrant nurses, are those uh, with countries that actually have very few Filipino nurses. So, I mean, what they tried to say was that most bilateral agreements, there are no bilateral agreements in countries where there are a lot of Filipino nurses. So that's one. But and that bilateral agreements are actually also only focused on recruitment, the outflow from the Philippines to the migrant receiving state.
Mhm.
I mean, it has to be expanded to include better working conditions, and to encourage them to express their opinions in terms of joining unions, reintegration, assimilation. But it's really uh, usually only for, even for domestic workers, for instance, for usually it just focuses on recruitment.
Mhm. So the focus is really on protections related to labor recruitment exercises, but not necessarily related to labor protections uh, in the overseas context. Um, Definitely an area for continued work. I mean, we think about the receiving country context being so consequential to the health and welfare of migrant workers, and also, long term in terms of social mobility, and also the ability for remittances, even in these countries where the disparity in income is so great. It also is more expensive to live in those environments.
Yeah.
I wonder, if you had a perspective in terms of like the net effect of migration in terms of remittances in light of the health-related problems that OFWs experience, and the kind of social determinants of health that they encounter. Is it ultimately? I mean, it's kind of hard to kind of think through it in terms of the decision to migrate. Is it a rational choice when we consider the totality of the exposures to health that are experienced and the cost, various costs that people experience, including being away from family, loved ones, children, sometimes for many years.
You know, Brian, it's actually sad because in these in the conflicts, wars, disasters, and diseases that I have uh, mentioned a while ago, you know, the discourse is that most migrant workers would not want to leave
Mm.
their host countries if they can help it. There have been instances when government tried to repatriate migrant workers, but I mean, unless it's really a life and death situation, they would never leave. So their sense of, I mean, it's an indictment of our country that their sense of security is no longer within our borders. They'd rather be there than, you know, than be here in the Philippines where they are unsure their getting jobs. But then it's not just rationality; it's also the sense of shame that they've failed when they go back. That's also part of it. So it's really not just the rationality. It's also, you know, shame, the guilt that they are not able to take care of their families, things like this.
So can you talk a little bit more about that? Because I think that's actually really important because we think of things, I mean, sometimes like economists, right? I mean, you think about things as rational choices,
Yes, exactly.
right? And then, you know, and so I kind of framed the question in that way, but, you know, as a psychologist also, I mean, we think about, you know, the emotion and other factors that obviously are driving these decisions and decisions, you know, longer term. So can you speak a little bit about maybe what you think the narratives are that OFWs are they have about their migration experience and how that might influence their decisions? And you also said shame, and so you know, what kind of shame would be associated with coming home?
The shame would be that they were failures, that they failed in providing that, especially for instance for men, they have to be quote unquote breadwinners and they could not provide for their families. The good sister, the good, uh, the good daughter who wanted to provide for her parents, for her siblings who could not make it abroad. These are things that also bother a lot of Filipinos abroad who will come home. And some are actually also getting out of abusive relationships here in the Philippines. There have been some feminist scholars who have, for instance, tackled that in their research.
I mean, that brings up another interesting avenue to explore too, because you know, as you're saying, there's an escape from, you know, domestic violence or to partner violence and other kinds of exposures that are unhealthy back home. There's also, I think, some scholarship too from a feminist perspective of, you know, in gender identity and sexuality being able to be expressed differently in a different country environment. Whereas due to Catholicism or other more conservative ideas in the Philippines, they can't really fully express their identities, which I think is.
That's true. That's true.
So Mao Shun Ran from Hong Kong University, who's also the chair of the Mental Health Working Group for Global Health and APRU, he asks, are there any special psychosocial supports for nurses or health workers during COVID-19 in the Philippines?
Yes, there are a lot of programs. The Philippine Mental Health Association has actually launched that program not only for frontliners but also for the public. My very own university has actually also has that program for frontliners, especially those that are employed by our hospital. So, I mean, I'm very thankful. I mean, this is something that you would not see 5 years ago as a concern.
Yeah. So there's really been a lot of increased interest and attention to mental health and psychosocial support.
Yeah, I think the lockdown. I think the Philippine government has instituted one of the strictest lockdowns and the longest in the world for that matter, such that, people can't help but think of mental health issues during this time.
In addition to and that's interesting because COVID-19 is really forcing many of us to think about well-being and mental health, isn't it? So
Yes.
it's an unintended positive consequence of COVID
Yes.
for us to be thinking now about psychosocial supports and mental health as a key aspect of health. And I think many governments are looking into this. Are there other protections that that the Philippine government has provided for nurses or frontline health staff, health workers to protect their well-being?
You know, i- After the lockdown, and when people are allowed to work, I mean, at the first month, I think, of the lockdown, the government has been criticized for not providing transportation to frontliners. Somehow had to walk to work to get to the hospitals. So I mean, that's just absurd. So, uh, but then because of public, what do you call this, protests, the government had to, you know, make a lot of effort to send transportation assistance to frontliners. Um, uh, there are also private sector groups who have been supporting frontliners in the work that they do now during COVID-19. So that's also one remarkable thing that happened with this pandemic, because they know that the government cannot do it alone. So a lot of work has been coming from private sector groups and civil society organizations.
That's a really important point. And there's several people have actually raised this issue also. We're going to wrap up in just a minute, but what can OFWs do themselves? So I think this is an issue that's been raised, and in the comments, the questions. But in terms of self-organization, in terms of advocacy from the community perspective, what avenues might exist, or what advice might you have in terms of OFWs abroad, or even frontline health workers in the Philippines, to think about it, and an approach to advocate for their own welfare and their own well-being, and what groups might they want to interact with, and what strategies might you think about that might be useful?
I think the best thing to do is to join unions.
Unions. Okay.
But then the sad thing is that not all countries are friendly to to unions. I mean, I think in the Middle East, it's not allowed. So how can you um, how can you do it? I guess social media advocacy would help, linking to migrant groups, linking to uh, unions, even if unions are not allowed via social media. These are things that would help, I guess.
So the power of the community should not be overlooked, and unions and self-organization is something that's really important.
Yes.
Dr. Jean Encenas Franco, thank you so much for your presentation and your wonderful discussion today. I think it's been enlightening, and we have all learned a tremendous amount about a very important topic, and the population that in many ways is neglected in the research literature. So thank you so much for being here today. This recording and the slides will be shared via email on the website at aprupplus.org, so aprupplus.org. And the next webinar will be at the same time next week. It'll be given by Dr. Jill Murphy from the University of British Columbia, who will talk about mental health and COVID-19. And we touched upon this today in Dr. Jean's talk, and so I think it will be a great topic for all of you to tune into next week. And Dr. Moshan Ram from Hong Kong University, so professor The Department of Social Work and Social Administration and the Faculty of Social Sciences at HKU will lead and moderate that discussion. It should be absolutely fantastic. So I want to thank everybody for your participation today, your excellent questions, and helping us to really promote an important topic related to migration and health. So thank you very much for joining us today.